Welcome to This Week in Washington for July the 13th, 2012. 2 weeks ago, the Supreme Court affirmed the Affordable Health Care Act so that it will be moving forward toward implementation. Today, I wanted to spend just a few minutes about some of the implications of this legislation that are very important for community and public transportation. One of these deals with the actual financing of this legislation and its impact on Medicaid, a vital resource for many community and public transportation organizations. The Affordable Health Care Act expands significantly the number of individuals who will be covered by health insurance in the United States. Medicaid will become a primary coverage mechanism for working low-income people as opposed to only poor people in the past. I know that in the last week you've heard a great deal of discussion about the Medicaid expansion in certain states, and that there are states like Texas and Florida that are opposed to implementing the Medicaid expansion. The important issue in Medicaid expansion is the financing. And unlike the current Medicaid program, if a state adopts the expanded programs under the Affordable Care Act, the Medicaid reimbursement rates for the next 3 years will move toward 100% federal funding. Following the first 3 years of affordable care, the legislation changes the matching ratios from 100% to the federal share being 95%. 3 years after that, the federal share will fall to 90% of all the Medicaid coverage and go no lower. There are no states currently receiving 90% funding for Medicaid, and for many states, this is a significant change. You may remember that several years ago, I began talking to you about the changes in managed care that were coming in terms of having Medicaid treated not as a government program, but more as an insurance policy. And in California, a place where more Medicaid recipients live than anywhere else, the entire Medicaid population has been moved to managed care. Think about this in a different way, though. The biggest source of financial deficits in the states during this recession have been generated over the expanding Medicaid enrollment created by high unemployment. This situation was so bad that Congress, in the first 2 years of President Obama's term, provided 100% financing for Medicaid. My theory is that if a state adopts the expanded Medicaid coverage, they will find themselves financially in a much better place than they have been for a decade. With healthcare being the single largest item being taken by federal resources, we can then assume that the states will have, for the first time in a long time, either a surplus or less of a financial deficit than they have experienced in recent years. What this means for community and public transportation is that the state efforts of our state associations and our state efforts of our partners to find more resources for transit should have an opening because of the credit that these programs are going to create. The other thing in the long term is, regardless of the 100% for 3 years, I do think even with the expanded population, states will never be in the same financial situation that existed when they were paying 70 and 80 and in some cases 50% of the cost for Medicaid. So I would hope that all of you who are involved at the state level with advocacy would be talking to your state associations now about planning how this opportunity could be an opening for transit agencies as states find themselves partially bailed out of their financial situation. For those states that we've heard of that are declining to participate, I think it will be very difficult when legislatures return and have to confront the needs of the nursing homes in the states, the hospitals, and the insurance companies to continue to say that they will not participate in this expanded Medicaid option. Those states that do will have opportunities for transit on a financial sense that hasn't been possible in the past. Those that fight it out over the Medicaid expansion inevitably will adopt the expansion, but it will take a little bit more time, I think, for transit to try to get more state funding using this opportunity. So unlike our usual discussions of Medicaid, it's important to remember that these changes do create additional opportunities for leverage at the state level. Additionally, during the discussions on transportation around the country the last 2 or 3 years, I know that many of our members have experienced situations where they've run into our friends from the Tea Party who said that, oh, well, the federal government's getting out of transportation anyway, so we're not going to make any more local commitments for this kind of service. The truth is the resounding votes in the House and the Senate are large enough that that argument, which never had any merit, has even less merit today, since a large majority of Republicans and Democrats both pushed for an extension of the transportation programs, both the highway and transit programs, that should be to our advantages in these discussions. Congress clearly recognizes the need to link these issues of healthcare and transportation, and in the last 2 weeks, we have some additional tools to begin to make our case. As you know, Scott Bogren carries on a regular series of conversations with our state transportation partners and our state transit associations, and we'll be letting them know of how we feel about this opportunity and sharing with them ideas about how we might impact the state situation to get better financial leverage at a time when the states can look forward to reducing their expenditures on health care. So that's what I'd like to pass on to you today. In the meantime, you'll continue to see more information from us about MAP 21 as well as the Affordable Care Act. And I look forward to hearing from you about how things are beginning to evolve. Thanks. I hope you have a nice weekend. And since it's Friday the 13th, try not to step under any ladders or beware of those cats that cross you in the middle of the street. Thanks. Have a nice weekend, and I'll talk to you soon. Bye for now.